Hello and welcome to News Across Nigeria. I'm Anne Nwawado. On the program today, Northern youths move to review eviction order to Igbos in the region, says indigenous people of Biafra does not speak for the entire Igbos. At least 3 people have been reported killed and 17 others injured following suicide attacks on 2 internally displaced people's camps in Maiduguri, the Borno state capital. And Asaba, the Delta state capital, submerged following hours of heavy rainfall. Residents cry for help. A coalition of Northern Youths Organization has asked Igbos to leave the north by October the 1st. They may have yielded to pressures and reactions that trailed the June declaration, but the group says that it is set to review its position following the ultimatum. In an interview with Channels Television in Kaduna, President of the Arewa Youths Consultative Forum, Yerima Shatima, said the decision to review the ultimatum is for the interest of peace and unity in Nigeria. He added that the intervention of some notable Igbo leaders have shown that the indigenous people of Biafra does not speak for the entire Igbos.
After the June Kaduna declaration, a lot had happened. So many things happened. The silence on the part of the Southeast governor actually prompted a lot of things that gave birth to the June declaration. And haven't seen a lot of things going on as regards to the governors having meetings to disassociate themselves from that iPod, believing in Nigeria, and also the organizations such as Ohanese and the Ohanese Youth Council and other prominent Nigerians from that same axis give us reason to begin to think of reviewing our positions. But then officially, when I say officially, you know, it's a coalition. We have not sat down to conclude plans on reviewing the position of things. But I hope very soon we will sit down and also review the situation. Then we will make our position very clear on our position on what we felt about the whole thing. To those who believe in Nigeria, they should remain calmly, there is no problem. But to those who felt they want the republic of their own place, they should not drag the North into that mess, because we strongly believe in Nigeria. They should go back to their area. Since they believed they want to go out of Nigeria and they want to form a republic of their own, they cannot build another nation in the mix of a nation that exists.
At least 3 people have been reported killed and 17 others injured following suicide attacks in 2 internally displaced people's camps in Maiduguri, the Borno state capital. A statement by the National Emergency Management Agency, NEMA, in the northeast says that about 11:20 p.m. yesterday night, a male and a female suicide bomber detonated their improvised explosive devices at Dalori 1 IDP camp, leading to the death of 3 internally displaced persons. It adds that another incident occurred at Dalori 2 ID camp, where a suicide bomber was intercepted, leading to the death of the suicide bomber. A statement by the State Police Command says there was another attack in the early hours of today as a male suicide bomber attempted to gain entry into the University of Maiduguri. On citing security personnel at the university on duty, the suicide bomber allegedly detonated his IED, killing himself alone. Several suicide attacks by Boko Haram militants have been recovered, especially in Borno State in recent times, just as the military claims to have decimated the group. Meanwhile, the Borno State Governor Kashim Shettima has directed the State Civil Service Commission to commence procedures for the recruitment of 300 unemployed graduates of various disciplines from the 27 local government areas of the state. Governor Shettima revealed this while presenting certificates to a group of youths who just concluded a year course on electricity at the National Power Training Institute. Governor Shettima says the aim of the employment is not just to engage idle youths, but to replenish the youth state's workforce with productive youths, and that will play a crucial role in the ongoing project in Borno State. Let's move to health matters now. Healthcare delivery for the people of Bauchi State has received a boost with the construction of 19 model primary healthcare facilities across the state. Well, this was announced by the state governor, Mohammed Abubakar, who says that the project is part of his administration's 5-point health agenda that seeks to improve health facilities. He was speaking when he received healthcare items from the United Nations International Children Emergency Fund, UNICEF.
According to the 2016 National Health Facility Survey, only 20% of the 30,000 primary health centers are functional in Nigeria. The report further stated that Nigeria is under severe need to improve health facilities and healthcare delivery system for its citizenry. These ambulances are part of the efforts by the United Nations Children's Fund and other development partners to improve healthcare facilities in Bauchi State. The partners donated drugs and medical equipment worth over 600 million naira. The equipment are to be distributed to hospitals and other healthcare facilities across the over 300 wards in the state. The UNICEF country representative said the supply will help in attaining optimal functionality of the 323 primary healthcare centers in Bauchi State to provide quality healthcare services.
Your Excellencies, I am glad to inform you that 16 trucks containing some of these equipment and medicine have already arrived and much more are still to be delivered.
This is expected to reach over 2 million women, men, girls, and boys with maternal, newborn, child health, and adolescent sexual reproductive health services.
The Bauchi State Governor, who flagged off the distribution of the item, expressed delight, saying that the state government is taking advantage of this opportunity to address the challenges in the state's healthcare sector.
In order to improve on the facilities rendering healthcare provision, we have constructed 19 model primary healthcare facilities, complete with accommodation for staff, VIP latrines, and solar-powered boreholes. We have also continued to address the human resource for health need of the state.
Through this intervention, UNICEF and other development partners are hoping to provide improved healthcare for over 1.5 million children under the age of 5 and 380,000 pregnant women annually.
Meanwhile, the National Primary Healthcare Development Agency is planning to roll out a new community health volunteer scheme to enhance mobilization of Nigerians to routine immunization at the grassroots. This program, which will start in Sokoto State, is also expected to deepen the fight against child killer diseases, at the same time create focal persons that will supervise immunization efforts. The executive director of the agency made this known during a meeting with the Sokoto State Governor, Alhaji Aminu Tambuwal.
Nigeria's health sector is ranked poor by the World Health Organization's recent ranking, which put Nigeria 187 on the list of 191 member states. According to a 2015 UNICEF report, every single day, Nigeria loses about 2,300 under 5-year-olds and 145 women of childbearing age. This makes the country the second largest contributor to the under 5 and maternal mortality rate in the world. Routine immunization is key to reversing the situation. Unfortunately, Nigeria is ranked among countries with unimpressive record in routine immunization coverage.
Then we also recognize
at this meeting, the National Primary Healthcare Development Agency and her partners are meeting the Sokoto State government to discuss strategies to improve routine immunization at the grassroots.
The government and people of Sokoto State will be collaborating with Sokoto State to launch and roll out the first intervention in primary healthcare, which is a scheme that involves community health workers. We already see what the government has done. So NPA-CDA will roll out the community health informers, promoters, and service providers first in Sokoto State as a show of our confidence that this environment is already suitable for us to scale up this cadre of workers.
As you are aware, USAID is very active as a partner across sectors in Sokoto, so we're taking advantage of this trip to see activities in the health, education, governance, and agriculture sectors.
The federal government has received requests for technical support from the state government on routine immunization, and already that request is being implemented. In his remarks, the governor of Sokoto State commended USAID and the National Primary Healthcare Development Agency for their commitment in improving health governance structures and well-being of the people of Sokoto State.
The partnership between the government of Sokoto State, USAID, and indeed the United States of America over the years has been a very, very rewarding and very, very productive one.
Already, the Sokoto State government has approved the establishment of ward development committees headed by traditional rulers and other influential persons to serve as focal persons in their communities.
Still to come on news across Nigeria, we'll find out what plans the federal government has in rebuilding the Northeast. Please stay with us.